Thank you so much, and good evening, everyone. I wanted to say that was quite a performance, and that the young ladies gave. It was just absolutely beautiful. Thank you so much for inviting me to speak tonight as you celebrate the 29th year of Metropolitan Asian Family Services and the critical work that you do for the people of Chicagoland. For those of you who may not know me, my name is Congresswoman Robin Kelly, and I represent many of the people you so graciously help connect with life-changing services. In Congress, I serve as Vice Chair of the Energy and Commerce Committee, which is responsible for much healthcare and social services legislation. I also serve on the Committee on Oversight and Reform and as Chair of the Congressional Black Caucus Health Brain Trust. So a lot of my work in Washington is related to what you all do at the Metropolitan Asian Family Services. I want to tell you a little bit more about what I've been working on in DC that is going to positively impact your work here in the Chicagoland. But first, I want to talk about the good work that you have been doing. You certainly deserve so much recognition for your hard work, Dr. Kumar. I am so grateful for the work that you do to connect underserved populations to vital public services like Medicare, Medicaid, Social Security, SNAP, and TANF services for their children. This year alone, you have completed 4,586 cases, and you've helped more than 10,000 people annually. That is remarkable. When people in this community need help, they know they can come to your doors and receive services they may not be able to receive anywhere else. So let me take a moment now to applaud you for this work. You are truly changing lives. So let's give a big round of applause. And help them raise money. Through the nearly past 3 decades, your work has impacted hundreds of thousands of people in Chicagoland. This work has always been important, but throughout the course of the COVID-19 pandemic, your work has become even more critical in supporting the needs of the community. We all know about the health impacts of the pandemic, but there have been serious economic impacts as well. And our low-income and underserved communities have felt the worst of these impacts. I'm certain that you have seen an uptick in the number of people who are coming to your door for help. Although there are signs that our economy is turning a corner and headed toward recovery, we are going to continue facing some hard times, and I want to encourage you to remain vigilant in helping your community. Please continue your programs for improved literacy, your translation and interpretation services, and your assistance with citizenship applications. In Washington, we are working to improve the immigration system to make it easier on folks looking to join our communities permanently. We will always need dedicated local partners like you helping people through this process and especially to overcome language barriers. In Congress, I am working to improve access to some of the other programs you help connect folks with. Through the Build Back Better Act, we are going to bring transformational programs to communities across the country. And I know that so many of the people you work with at Metropolitan Asian Family Services are going to benefit. One of the most important aspects of this legislation is closing the Medicaid coverage gap. In Illinois, we're fortunate to already have expanded Medicaid, but there are still 12 states who have refused to expand this vital coverage. We must make sure that everyone has access to affordable health care regardless of where they live. I know Metropolitan Family Services helps many seniors across our region. We are working to improve the Medicare program to cover important services like dental cleaning and dentures, hearing aids, and eyeglasses. We're also working to extend the child tax credit, which I'm sure you've heard about. The tax credit has been so important for families in Illinois, and the majority of people benefiting from the tax credit are using it to provide food and clothing for their children. We are working to expand paid leave so that every worker knows that their jobs will be protected if they need to step away for a little while to care for themselves or their families. Studies have shown that paid leave and affordable child care, which is something else we're working on, actually helps more people, and especially women, remain connected to the workforce. I hope that the next time I see you, I'm going to have more to tell about the resources coming back here to Illinois and Chicagoland to help you and to help the people that you serve, or my colleague, Krishnamurthy, will tell you. Congratulations again on another fantastic year of work on behalf of the communities that you serve, and thank you for your dedication. I hope everyone enjoys the gala this evening. Thank you so much.
Thank you so much.